Good morning, everybody. For those who have just joined the webinar, on behalf of the Senior Transformative Agenda Implementation Team, I would like to welcome you. Just to quickly give you a little introduction to the WebEx platform that you're using, in case you haven't used it before. We will be starting the actual webinar session in 5 minutes, but in the meantime, you can have a look at some of the functions. With the top right-hand screen, you have the participants, the chat, the notes, and the polling button. Click on these to open the panel on the right-hand side of your screen, so you can see who the other participants are in this morning's session. You can use the chat to send comments to either everybody in the webinar or to specific participants. We request that everybody remain muted this morning, please. So when you join the session, just check that your microphone next to your name is orange, which means it's muted. We encourage you to ask questions for the presenters. If you have questions, use the chat function, select the participant called question, and send them what you'd like to ask the presenters. We'll pass it on. And finally, you can take your own notes during the session using the notes panel, and you can save these to refer to after the session. So like I said, we'll be starting shortly. In the meantime, make yourselves comfortable, and thank you. Hello everybody, just one more final comment before we get started. We do also have our technical support participant. So if you're having some trouble, you can send a chat through to technical support. And you can also use your telephone to call into the session this morning if you're having problems with the audio on your computer. The phone number is on the screen in front of you with the access code. Right, we'll be getting started in about 2 minutes. Thank you.
Good morning. Welcome to the webinar on improving humanitarian response, lessons from the operational peer reviews. The fog has just lifted in Geneva, so I hope that the webinar itself will lift some of the fog you may have from understanding the operational peer reviews. I'm joined by Panos Mumses, who's the director of the Senior Transformative Agenda Information Team. Earlier, he had been the UNHCR's Regional Refugee Coordinator for areas around Syria. And before that, he'd served as Humanitarian Coordinator in Libya, amongst many other places. Ingrid MacDonald is the director of the Norwegian Refugee Council office in Geneva. She's also served as the Regional Protection Advisor and a leader of the Protection Cluster in Afghanistan, and has worked with Oxfam in Sudan, and a number of other places before that. I'm the director of UNDP in Geneva, and also had served as Humanitarian Coordinator in Sri Lanka. And all of us have been involved with operational peer reviews. Panos has been involved with all 3 of them, and Ingrid and myself have been involved with 2 of the 3 peer reviews. Before going further, I just wanted to run through a few instructions. If you could just, I know you've been reminded before perhaps, but keep on mute. If you have questions, send them to the question person who's listed there on your screen. Similarly, if you have technical support questions, send them to the technical support person using the chat function. We'll be recording the session, and we'll make this available online for other people who may not have been able to hear it. We're having 2 polls asking you questions. One's happening right now, so if you could have a look at that. And then there's a second one that will be at the end of the session in about an hour, which is essentially an evaluation. It's very important that we get your feedback for that. This is the first of a series of webinars on TA-related issues around making humanitarian response more effective. So your input is very important. I should also say that we had a technical issue here this morning, and it's possible that not everybody who wanted to get into the webinar could. So we're trying to make alternate arrangements, and apologies for that. But just to move on with the next slide. On the Transformative Agenda. I think most of you know that the Transformative Agenda came out of experiences in 2010 with the Haiti response and the response in Pakistan, where it was felt that the system we had essentially hadn't met effectively the needs of the people, partly because the way it was set up was maybe too rigid, wasn't accountable enough to the people on the ground. So a whole series of measures were taken to create the Transformative Agenda and to address what were felt to be some of the key shortcomings from earlier responses. First was the issue of leadership, both getting the right person as humanitarian coordinator, but also in terms of strengthening the Humanitarian Country Team as a whole and the support that is given to that humanitarian coordinator. You'll be hearing more about that later from my colleague Panos. Second is issues of coordination. Our cluster coordination system had lots and lots of strengths, as I saw when I was humanitarian coordinator, but if it was run out in too rigid a way or not really adapted to the context, there were weaknesses. So that's the second thing the Transformative Agenda tries to deal with, and Ingrid will be talking about that. And the third issue is on accountability. And as I mentioned earlier, that's pretty fundamental to the approach, because it was felt that our earlier responses, we were fairly accountable to ourselves and our own bureaucracies, but we weren't actually accountable to the people we were supposed to be serving. I'll just move on to the next slide right now. Now, we've had a number of level 3 responses. First was in the Philippines, and in that we had a model where there was an RCHC in place. That RCHC stayed in place and was supplemented by a deputy humanitarian coordinator for the first part of the response. In Syria, we had a level 3 response. In that case, there's a existing resident coordinator and humanitarian coordinator, supplemented by a regional coordinator. In South Sudan, it's a bit of a different model. We had a DSRSG, RCHC, a triple hat on the ground, and that's been supplemented by a deputy humanitarian coordinator. In Central African Republic, we have a senior humanitarian coordinator dedicated, working side by side with a resident coordinator and people from the mission. And in Iraq, the model is somewhat similar to that in South Sudan. I'll just move to the next slide. The STAIT is a team that's been put together basically to help implement the Transformative Agenda. For those of you who want to win trivia quizzes, the STAIT stands for Senior Transformative Agenda Implementation Team, and is made of Panos, Ingrid, Andy Wiley, who runs the policy side of OCHA, Paddy McIlvery from Interaction, and Dermot Carty from UNICEF, along with myself. And we're supposed to be helping ensure that actually you people on the ground, well, people in headquarters, but mainly people on the ground, understand what the Transformative Agenda is about, but not so much understand, but actually can apply it to make your work better. So that's what this webinar is partly about. So, and the operational peer review, that arose from earlier work we've done in developing the Transformative Agenda, looking at something called real-time evaluation. And we went to a number of countries. The most important one was South Sudan. And we got the feedback that the RTE was a good tool for evaluation, but wasn't a good tool necessarily to improve operations. So hence the idea of this peer review, which is an interagency management tool. It identifies areas for immediate corrective action early in the response. It's supposed to be done 60 to 90 days into a response. And I think key is it's done by peers. It's not professional evaluators. It's people who've actually been in the job, done the same, tried to meet the same challenges those people in that level 3 emergency are trying to meet. We've had some initial feedback on the polling question about how many of you have been involved in an OPR. It seems relatively few have been involved in an OPR. Some of you know a little bit about it, but not many. So it seemed from the initial responses that you should be an eager audience. I'm sure my colleagues will be happy that we have an eager audience. I'll just go to the next slide, which is passing over to Panos to the first part of the presentation on challenges and opportunities. Panos, over to you.
Thank you, Neil, and good morning, everybody. What I would like to do together with Ingrid in the next few minutes or so is really to give you a highlight of the most critical issues that came across in these operational peer reviews and the missions that we undertook to the field. What our objective of this presentation is hopefully to relate to each of you and make sure that as we describe these issues with examples, to hopefully inspire or help some of the colleagues in the deep field and operations to take forward these lessons learned and hopefully to apply them to your own situation on the ground. So in the presentation this morning, we're going to highlight primarily, as you see on your screen, 6 issues. There's many more that we saw in the operational peer reviews, but this we thought are 6 representative of significant issues that we wanted to share with you in this presentation. I would flag them very quickly, and then we'll say a few words on each of them. The first one is issues related to leadership by the Humanitarian Coordinator or the Humanitarian Country Team, and the effectiveness of the HCT on the ground. The second one relates to strengthening delivery. Bottom line, what we do is really about making sure that we give the very basic life-saving assistance for those who need. The third one is on coordination, right-sizing the coordination, looking at the coordination as a means to avoid duplication, but to be effective and not too heavy at the same time. The fourth one relates to security, an important element to be able really to deliver, and do that criticality judgment on where we need to be. The fifth issue relates to accountability to affected people. I have to say one that we often neglect or don't do enough, engaging the affected people. And the sixth one relates to the centrality of protection, making sure that this rights-based approach is applied throughout, regardless of what we do on the ground. So I'd like to move to the first one and look in particular at issues related to leadership and HCT effectiveness. So what we have seen in these operational reviews we have done in either Philippines or CAR and other places is really that the empowered leadership protocol has not been utilized, activated enough. Basically, what the guidance stipulates is that if there is a situation where there is a dilemma or hesitancy or the HCT cannot come to a consensus, to a forward-moving way, then the Humanitarian Coordinator has the power to be able to take a decision and to move forward. That protocol has been overall rather underutilized, and there is also not much kind of understanding about it. What we also saw is that there is a need to shift from an empowered leader to an empowered leadership team. Basically, I think we all expect the Humanitarian Coordinator to be this superman or superwoman that can handle everything. And what we've seen more and more is that one needs to have a lot more of a team approach, an entire empowered team, have at least a core team within the HCT that are the shakers and movers, the ones that make things happen, who support the Humanitarian Coordinator, but also have a lot more of a team approach. That really has varied from one country to another, but overall, the empowered team approach is not activated enough on the ground. I'd like to move to the HCT effectiveness, and there I think there's a number of issues related. The first one, and most important, is the Humanitarian Country Team's composition and size, to make sure that it's not too huge. I think when we went, for example, to Sudan, initially we found an HCT that had 60 members. Obviously, one cannot operate or take decisions with 60 people sitting around the room. So one needs to have a smaller core group, maybe a dozen or so of the main actors, involving NGOs, involving UN agencies, the main actors to delivering and accountability to ensure that that team is small, is flexible, and most importantly, is able to take decisions. And the decision making is really extremely important to make sure that there is a process to come with the options, to look at what the options are, and then to definitely take decisions to move forward so that the ACT is a decision-making body looking at the higher strategic direction and vision in terms of where to go. A common vision is really a key issue. The ACT, the humanitarian actors, the team on the ground need to have a common vision so that if one asks one or another member to know what's your vision, where do you want to go, that has to be in place. But most importantly, to be able to identify strategic priorities. The vision and priorities is not the same thing. And I think that the priorities often, I have to say, we saw in operations, it's the agencies who flag the agency mandate-related priority. But here what we're talking about is the totality of the humanitarian actors to be able to have priorities in terms of what's the most critical issues that they're facing at that particular moment. Priorities could change, could evolve, but it's really important to have that in place. The roles and responsibilities, hugely important. What is the role of the Humanitarian Country Team? What is the role of the intercluster working group? How does the field relate to that? What's the sequencing in between the field, the intercluster working group, the Humanitarian Country Team, in terms of looking at the issues to both come up to the HCT to take the decision, but also to give guidance all the way down to the clusters and the field location in terms of strategic directions, dilemmas, priorities, so that everybody sings to the same song. Everybody really has the same understanding. And of course, an operation involves, and what we didn't see is that this communication to happen across these platforms in a timely manner. The last point related to the leadership is really the deployment of Deputy Humanitarian Coordinator for major operations. We felt that there was a need for, while the Humanitarian Coordinator is in the capital and deals with the government, with the HCT, with a number of actors, there is a need to have a voice and a presence for at the senior level in the field that looks a lot more at the operational delivery and also is the face to and the guidance to the colleagues in the field in terms of linking it with the HCT, linking it with the strategic level, both bringing issues up but also being able to communicate. So we have recommended that as a standard practice in these major operations, it's tremendously helpful to have a dedicated Deputy Humanitarian Coordinator with a particular focus on the humanitarian program delivery side of the operation. I'd like to move to the next set of issues, which is really related to the most important aspect, I would say, of what it's all about, which is about delivering, making sure that the system we have in place is really fast, is agile, and is able to deliver. A key issue we found there in all actually of the operational peer reviews we did in the Philippines, the Central African Republic, in South Sudan, is the ability of the Humanitarian Country Team to be able to monitor the delivery, to be able to have the finger in the pulse, at least on a periodic basis, I would say at a minimum once a month, to be able to say, here are the needs, and this is how far we have delivered. We have only met 20% or 80% of the needs, and to be able to adjust this based on information coming from the information management colleagues, obviously from the operation side, but to have this delivery in mind. I mean, these operations, we're talking about $1 or $2 billion operations. If it was on the private sector, you would definitely need to have a regular update in terms of what has been delivered, where, and what are the unmet needs. A second issue is the prioritization of resources by strategic objective. Again, you have the strategic response plan, the SRP has the strategic objectives, but also the priorities adapt according to the context, the operational context, that in all of these situations we saw actually changes quite a lot. Already a month or 2 months or 3 months, it's a lot. It's a long period, and therefore there has to be this prioritization that is commonly understood by all. It's not enough to just have one agency or the humanitarian coordinator, but everybody to agree on this, on the priorities is extremely important. The third issue on the delivery we saw is really to balance the deployment of staff that go there to do coordination versus staff who are there to deliver programs. For example, what we saw in the Philippines, there was a disproportionate number of staff who were deployed in order to do coordination. And this is something we need to be wary of in the transformative agenda, that while we of course want to make sure we have the cluster leads and co-leads and the program coordinators to avoid duplication, but bottom line, we're doing all of this in order to deliver. And there has to be the HC, the HCT, the team needs to keep track of the balance between the coordination staff and the delivery staff, making sure that the focus is in the field, in the deep field, and there is enough staff who are out to be able to go and deliver and monitor the delivery as we go through in the operation. I would also like to then move to another area, the last point on the delivery, which relates really to an important issue, the living conditions for the staff. While, of course, we have all been in situations when we first get deployed where we'll stay in very basic in a tent and have a shower with the buckets at the end of the day, I think once we go into a second or a third month of the operation, it's extremely important that there is at least one person dedicated in this deep field location who establishes a base camp, who establishes some minimum living conditions for the staff. So everybody, once you come back at the end of the day, you have a bed, you have a hot meal, you have a minimum hygiene, which I think affects staff morale, staff deployment, and staff welfare to be able to continue for the longer term for the operation. I'd like now to hand over to Ingrid, who will take you to the next part of this presentation. Okay, we're trying to connect with Ingrid.
Hello, everybody. Hello, everybody. Good morning, good afternoon, depending on where you are. I'm going to cover the issues of coordination. Panos has already touched on a number of the key points. One of the most important issues that has come up through the various OPRs and STAIT missions is the issue of clarity around roles and responsibilities. And here we particularly mean with the coordination, the clarity between the roles and responsibility of the HCTs, the intercluster working group, as well as the cluster coordinators within their own clusters. The more defined this is, and where it's clear also in terms of the expectations between what is a strategic role versus what is more a coordination and operation role, helps significantly in terms of the efficiency and effectiveness of the response. One of the other things that is very important here is also the clarity when it comes to the issue of agency, the role of agencies in terms of the role that they play within the HCT and also the role that they play within the intercluster working group. So here we have cluster coordinators who can be representatives of agencies, but also we have agencies sitting in HCTs, and which hat are they wearing when they're sitting in those different forums can be of the agency heads is something that has come up in some of the situations like South Sudan and others. And here, having one of the recommendations that came out of the OPR in South Sudan was to have things like regular meetings between cluster coordinators and agency heads, particularly those that have the responsibility for 3 or 4 clusters, to ensure that there is appropriate representation of cluster viewpoints and intercluster concerns within the HCT. The other thing that was quite also important was the issue of communication. Communication can be through a variety of different mechanisms, but just simple things like keeping minutes and circulating those minutes and making sure that they go within the different forums was also very, very important. This was particularly the case in places like the Philippines and others,
where there was sometimes frustration in terms of where the intercluster working group felt that they weren't always getting they were sending things up the chain, but they weren't always getting decisions coming back, even though decisions were being made. And so simple communication mechanisms and ensuring that those are systematic and clear to everybody is also a very useful way of reducing some of the concerns around lack of information sharing or lack of direction. One of the areas also that came out was, which Panos has already touched on, is the issue of monitoring. How are decisions made in the different forums? And in different clusters, we saw, for example, in the Philippines, that many of the clusters had IM capacity, whereas in South Sudan, we didn't see that level of IM capacity to the clusters, despite the best efforts, actually, of the agencies and others to get that capacity in. Having good IM capacity with clusters that is working across with a strategic framework of monitoring is very, very important for feeding up the chain and allowing the HCT to be able to make decisions based on facts. And this is an area where there is a lot of work happening in the field, but there's definitely a lot of work that's also needed in terms of support from the global level. Also, you'll see in the different points is the balance in terms of the issue of surge. There is a bit of a struggle. We were looking primarily with the OPRs at L3s. Now, with L3s, as you know, the mechanisms provide for a surge to come into place. Those surges is incredibly important for clusters, provided we get it correct in terms of the coordination versus the operational, in terms of the resources and capacities that are supplied. But what happens after the L3 goes? And what happens when you have rotations of surge on 1 month or 2 months deployments? And so one of the key recommendations is when we look at surge, we need to look at 3 month deployments as a minimum for the initial surge, but we also need to have in place transition plans. And this came out strongly both within the Philippines and also within South Sudan, where, to be fair to many of the cluster coordinators, they were struggling with who will come next and how do we fill these capacities. And this is something that needs to be taken on much more systematically, is how does the response transition out of an L3 and ensure that the people doing the coordination have the necessary support and resources. Finally, the issue of getting it right between the deep field and also capitals. A lot of the surge we saw would sit in capitals, often feeding the different processes around the humanitarian program cycle, the information products requirements. But what this meant for the deep field is sometimes that they felt a little bit disconnected, and we also saw a duplication of the same mechanisms and capacities at different deep field locations. Here, the issue of hubs has been taken on quite strategically by South Sudan to try and deal with some of these concerns of getting the resources out in the place closest to the beneficiaries and closest to the first responders, and this is very, very helpful. But a very good example that we saw was rather than having this potential for siloing within the clusters directly to capital, rather than allowing them to work across within their field locations, was to have, in the Philippines, we had the protection cluster, which had a roving cluster coordinator. That cluster coordinator went from every deep field location. There was 5 of the different hubs, and on a rotation of 2 weeks would then go into capital. This brought much more of an operational focus into the discussions, and also ensured that the cluster coordinator was deeply ingrained in terms of the management of the cluster, in terms of the field. And so these types of roving capacities, when we're in the heavy initial emergency response, was also seen as being very beneficial for the deep field response. Okay, I'm going to, on those main points, I'll hand back over to Panos. Where is Panos? Yeah, good.
Thank you, Ingrid. I'd like now to move to the next point, actually the 4th of this presentation, and we'll focus primarily on the questions related to coordination, and in particular with regards to security and safety of the operation. I think we all agree that we want to make sure that the security analysis done is responsible, and also that the program criticality analysis is done in the right way. And I think what we're talking right now is the balancing in between the security analysis and the program criticality, and making sure that this responsible decision is made. I think we all agree the objective is to stay and deliver in a responsible manner, making sure we don't expose ourselves, we don't expose our colleagues unnecessarily. At the same time, we have this responsibility versus the affected people to make sure that we're able to move forward. So moving with security analysis, I think that's really important to make sure that it takes place in a proactive, in a responsible way. I think we've all been in situations where we have been told about what we cannot do. I think what's really important is to be able to know what one can do and how to move forward in getting this analysis, understanding the context, understanding the actors, the non-state actors, whatever the local security analysis is, that is up to date and proactively tries to find ways to balance around staying and delivering. And of course, the role of the colleagues of the UN Department of Staff Safety and Security, the role of the security management team, the role of the head of agencies is extremely important. What I think I'm talking about is to have this enabling security culture, to be ingrained, to have this culture where, yes, of course, we don't want to be exposing anybody, but at the same time, we're there to deliver. And I have to say, in the missions we have done, we haven't always seen this approach on the ground. Quite often, there is more this security-averse attitude, which is, of course, sometimes takes measures which are stricter than what they should be, and that, of course, has an impact on the operations and the support we're giving and the help and protection to the affected people. So balancing out in between the two is really important. The other point I want to make here is really the sharing the security analysis between the humanitarian actors. What we have seen is that there is a lot of information that is out there. If one talks to the NGOs, if one talks to the UN agencies, if one talks to other actors on the ground, missions, government, and so on, they all have a lot of information. What we haven't necessarily seen is this sharing and bringing it all together in a way that information is power. Having the right information really makes the team to be able to take the right decision at the right moment in a very quite shifting and fast evolving situation on the ground. So really the staff security and safety is hugely important, and at the same time there is, I think, a need for improvement in terms of making sure that it's done in a responsible way. I'd like now to hand over to Ingrid, who will take us to the next point.
Thank you very much, Panos. I'm going to cover the issue of accountability. And when we're mainly talking about accountability, we'll be talking primarily here about accountability to affected populations. The issue is that accountability to affected populations is one of the areas where there's been a lot of discussion in some of the groups looking at the humanitarian program cycle and others about how this should be the center of our operations and also the center of our planning documents, our monitoring, our indicators, all these sorts of areas. There's still a long way to go on this, as those of you in the field will understand. But what we did see is that there is a need. This is probably the area where there's most room for improvement across the response, but also most desire and most demand for a deeper understanding and for guidance in terms of how to actually do this strategically across the operation. And this was also very evident in terms of not only by field actors, but also at the strategic level, at the leadership level. We saw, for example, in South Sudan, and in the Philippines and in a real desire for there to be from humanitarian coordinators, from HCTs, to take accountability to affected populations seriously, but having the tools and having the understanding and having the mechanisms to be able to do that systematically across the operation is still somewhere where there's a lot more room to go. There are and here there is a distinction between what is the programmatic AAP versus a collective AAP. The programmatic AAP, many, particularly NGOs, have done a lot of work on this area for a long time, and we saw this in a variety of different areas. And here, particularly the national NGOs, is an area where there is potentially much more of a comparative advantage in terms of their engagement with populations, affected populations at risk, which wasn't always being systematically integrated within the response. There was a lot of good examples, though, of AAP at the field level programmatically in places like the Philippines and others. But also in the Philippines response, what we really saw was the role of government in terms of AAP, which isn't often integrated. The Philippines is a society which has a lot of communications, they have a lot of feedback mechanisms and feedback loops, which wasn't always totally appreciated when the response first came in. And this is something that the country team and the people on the ground did a lot of work to deal with, particularly through the communicating with communities, working groups and mechanisms that were set up at the field level. So there are some very good examples to come out of that. However, there was also a lot of questions, particularly at the leadership level, between the difference between collective AAP versus programmatic AAP. And here, how do you actually ensure a collective approach across the whole of a response? And this is one of the key areas for further work. One other area was that there was attempts, for example, with the Philippines and other places, to have the EDGs came up with a plan in terms of accountability to affected populations. But having plans that come from the outside that provide some guidance doesn't necessarily provide what is required to bring in the local knowledge. And so very much there was a feeling that came through from right across the board that AAP needs to be built up from a bottom-based approach rather than an approach that is imposed. And so this is something where there was quite a lot of learnings have come forward, and this is being taken forward in the various task teams that are working on this. Also, the need for leadership and the need for this to be a priority and to be within the performance evaluations of HC and HCT members was also seen as being absolutely critical, because there was a huge desire to prioritize this, but then people said, actually, this takes time and this takes a lot of work, and so how do we do it effectively and efficiently? And so if it's going to be in performance evaluations, they also need to have the mechanisms in the field to do this. Okay, so that was accountability to affected populations. I'll now go on to protection. So in terms of protection, the issue, protection it was one of the areas that came out quite strongly right across the board, and this is both in the natural disaster situation of the Philippines with a rapid response, as well as more the conflict situations that you see in CAR, as well as the mixed situation that we are currently seeing in South Sudan. So we had a great diversity in terms of protection learning. A key issue is that, as you know, there is the Rights Up Front agenda, as well as the Interagency Standing Committee note on the centrality of protection. What was also evident is that there were some people who knew about this, but there was also a lot of people who don't know about this. And so there is a lot more need to really reinforce the centrality of protection, as well as the various notes and other mechanisms that have come out of Rights Up Front within the overall humanitarian response. There's also a real need for this to be taken up at the strategic decision-making level. So one of the struggles in some of the locations was that protection seemed to be put in the National Protection Cluster, who was doing often a lot of very, very good work across the different contexts where we were visited, but it wasn't necessarily being taken up at the leadership level beyond some of the political issues. And so the protection cluster could do a lot of work on the operational side. They could do a lot of work in terms of engaging with other clusters on mainstreaming. But when it came to the bigger strategic leadership issues, there is a real need for HCTs to have much more engagement. And in the case of South Sudan, we actually recommended that there was a need for an HCT plan, because protection was one of the most critical, if not the most critical issues that was being faced. One of the other things that we saw was that the issue of the dilemmas, and this again comes out with the leadership area. In a place like the Central African Republic, you have people on the ground facing the dilemmas that they've faced in many places before, such as whether you relocate or whether you don't relocate. We also see this in South Sudan at the moment in terms of the POC sites. Do you move people or do you don't move people? This sort of dilemma is there's often no right answer. It has do no harm implications no matter what you do. It has implications for the civilian population. This is really something where you need to have that strong leadership, but also collective leadership across the response, so that there is an inclusion and an engagement in terms of ensuring that those people who are implementing these processes, one, are heard, but also that they have the sufficient backing to be able to do what they need to do. The other thing that was very clear was also how, including with rights up front, was how that there is the engagement with the different missions. And so in both in the Central African Republic as well as South Sudan, you have an integrated mission structure. What does this mean in terms of protection, and how is that engagement taken forward? And so one of the things that the South Sudan team has done very well is try to set up now regular processes of not only having the HC taking up that role, but also having a broader HCT group engaging with the mission to try and resolve some of the difficulties that they face on the ground. And so these types of regular, predictable engagements can really help engage on protection issues at a very at a more systematic level. Prioritization was definitely, and panels touched on this before, was definitely a key issue for protection, as well as gender. And so gender was probably one of the most concerning areas to come out of some of these responses in terms of how gender is being prioritized or not being prioritized. We saw this both in one of the responses where technical teams were making decisions not to collect sex disaggregated data, which was affecting then the whole of the response. And this was despite high-level attempts to try and intervene. This type of deprioritization of gender is something that there obviously needs to be much more revisiting around. What we also saw is in a place like South Sudan where you have high levels of SGBV, really having those operational actors on the ground who have the time, capacity, expertise, and ability to be able to engage more systematically is a real struggle when you have a massive rapid response process that's heavily dependent on logistics. So how do you balance that, and how do you ensure that those actors are sufficiently prioritized? And we see this in the funding streams where, as always, protection, gender, education, these sorts of areas are often the most underfunded. So this is one of the key challenges for the system going forward, and we hope that some of the learnings from these processes will help inform that better. So I'm going to hand over now to Neil in terms of trying to do this, which is a struggle for someone as technologically incompetent as I am. Okay.
Here I am, Neil is back. And Ingrid is actually amazingly technically competent despite what she says. And so that's a bit of a highlight from the lessons that we've learned from some of the OPRs. Of course, there's a lot more there. The summaries of the OPRs are available. And if you want, through contacting OCHA, you can get full reports of the OPRs. I mean, some of the OPRs dug into some of specific cluster issues more. Some looked at issues of transition and recovery. All of them we've tried to actually do policy learning. But now's a bit of time for some questions. So I'm just going to start off with some questions that were sent in advance and to address them to Panos and Ingrid, and I might chip in if I can. First question was, we've seen over the years an abundance of evaluations and reviews and assessments of large-scale humanitarian responses. Sometimes mistakes are made and the challenges we face are repeated. And some examples are, for example, this issue that Ingrid just discussed on enough focus on gender, lack of participation of affected communities, issues of leadership, issues of one of these United Nations words, siloization of the clusters. So the question is, how can the OPRs not repeat these mistakes of the past? And what's our leverage to actually make change with humanitarian coordinators, heads of agencies, teams, to change the way they do business? What makes your report different to other evaluations? And how do we know that we've had impact? Panos is going to give a respond first.
Thanks, Neil. I think the question we just got is really pertinent. Unfortunately, one sees the same mistakes repeated again and again in operation after operation. What we're trying to do differently through the operational peer review is that at the end of each plan, the report some of you may have seen is really, and the action plan that comes of it is developed together with the Humanitarian Coordinator and the HCT on the ground. We always have a last day of a retreat where we come together and shape and form this action plan. Now, there is an accountability from the HC and the HCT 60 days after we complete these missions to update on the actions that have been taken. We try to make sure that these reports come with a manageable number of recommendations, a dozen or so, and also these recommendations are doable within a short time frame. The objective of the review, as in comparison with previous evaluations, is that to come out further on during a crisis, in the first 90 days or so, to provide some course correctors if needed and some action plan that will be implemented earlier on during the crisis as opposed to having an evaluation a year later. So the timeliness is crucial, the practicality is crucial, and then these recommendations, the report itself, but also what was implemented goes back through us, to the emergency directors, and to the principals, the head of the organizations at the top level, to make sure that these actions have been actioned, implemented, and taken place at the operations on the field. Neil, over to you.
Thank you, Panos. A second question is that there's been OPR missions to several countries. What has been the follow-up from your side after the OPR mission? And what are the consequences if humanitarian leadership in a country chooses not to follow your recommendations? What is the power of the OPR? Panos will respond again. We're switching to Panos. Just a second. Panos should be on. Okay, we're putting Panos on now. There. Okay, you're on.
All right. The follow-up to this reviews, operation reviews, is really critical, because otherwise, of course, what's the point of producing another report? So we follow up once we come back. First of all, seeing if this country, this operation needs additional technical support, if they need some expertise. For example, on the last OPR we just completed in South Sudan, it was followed by a mission by the Global Protection Cluster who looked into the protection strategy. It was followed by the Intercluster Working Group. There's been a number of technical support provided to the team. So it's not just about doing the report, but it's about also supporting this team and the operation to move forward with implementing, having the right technical know-how and reinforcement to be able to take further the implementations. Also, there is a timeliness to it, which I think is really something we're very keen to make sure it's clear that one has to implement it within 60 days, and also it has to be an implementation that it's really not to be done over the next 2 years, but within a short period after the mission. And that also affects the criteria in a way with the issues we go. Some are more longer term. What we're looking with this operational peer reviews is really this immediate, tailor-made application of the protocols. And what we've seen is that it's not about taking all the protocols and applying them, but just really taking the ones that are relevant, tailor-making them, and then from our side, ensuring that this follow-up on implementation takes place in a systematic way. Neil, over to you.
Thank you, Panos. We have one third question, which is that in our presentations, we have said that the Senior Transformative Agenda Implementation Team seeks to contribute to a culture shift in the way humanitarian actors work together. Culture shift and fundamentally changing the way humanitarians work together is something that takes years to do and has to do with breaking down everything from habits, rituals, prejudice and fears to organizational silos and mandates. How long is your own mandate and vision for, and what is your strategy to shift culture in the huge, bureaucratic, and diverse humanitarian community that we are? I don't know if everybody would agree that we're huge, diverse, and bureaucratic, but Ingrid is going to try and answer that. Over to you, Ingrid. You have the microphone.
Thank you. Do I have the microphone? Yep. Okay. Okay. I mean, this is a massive question, and I think, to be fair, it actually goes far broader than what the state can achieve or what any OPR can achieve. I think Panos has already covered in terms of some of the areas of follow-up that actually goes on, and all of these area of follow-ups and all of these missions will hopefully contribute to some form of culture shift. But ultimately, culture is something that organizations also need to take responsibility for. When we talk about accountability, when we talk about leadership, I mean, this is also within organizations. And so hopefully some of these global lessons that have come out of these OPRs will also feed through within the various mechanisms within the interagency standing committee, but also within the different agencies and NGOs, so that these can actually be absorbed and taken seriously. When it comes to the issues of silos and mandates, this issue is definitely something that, as an NGO, from an NGO background, is something that does cause quite a few concerns in the field, and also quite a concerns at the operational level. I mean, there are attempts to deal with these sorts of things. Again, I think that the learnings from the state and the learnings from the OPRs can contribute to that, as well as these follow-up missions building on the recommendations within them. Because one of the things that's important about all of the OPRs in the states is that the recommendations actually come from the field. They're not something that are invented. There's an action planning process that is done with each one of these processes. There's a self-assessment processes. We're there for a week. There's massive levels of consultation and interviewing. So this is actually the concerns and the perceptions and the recommendations from the field coming forward. So it's really also for how this is actually put through, I would say, very much at a global level, and then how that also filters down through the system, both from up from the field, but also from the top down.
Thank you, Ingrid. Just to add from my own experience, working on humanitarian operations in 85, 86, there was absolutely no support that you got from headquarters. But working as Humanitarian Coordinator from 2007 to 2011, there was a fair amount of support, but there wasn't the focused support like there is now. So I think that's one of the things that's different. The system is better set up to try to address these issues. Whether it makes the difference, we still have to see. But there is an honest effort being made. And in that spirit, I wanted to ask one more question. Based on the learnings from the OPR, how can the global level better support the field to meet the challenges you've identified? Exactly the question that I had, or the point I had raised about support. Panos or Ingrid? Panos, I'll give the microphone to Panos.
Things that need to happen. First of all, it's these protocols. I think this guidance, the policy itself, as we apply it, as we see in operation, does need some adjustments. The application of this architecture, it needs to be reviewed, and so that this policy or guidance, as we learn the lessons, is adopted, is adjusted, is fine-tuned for future operations, so that the same mistakes or whatever needs to be improvement it needs to be done. And actually, with the operational peer reviews, not only we provide the support to the countries, but we also see what needs to go back as feedback at the global level in terms of policy adjustments and changes that need to take place. The second point, I think, is that while the field and the operations, the colleagues obviously would do their absolutely best. We have seen incredible energy and motivation and really hard work on the ground. That alone is not enough. So the headquarters support, the headquarters mobilization in terms of the deployment of additional staff, in terms of technical expertise, in terms of supporting in a constructive way the operation, while allowing the operation to have their own space, at the same time making sure that the logistics, the support takes place in the right way. Also the resource mobilization being hugely important to make sure that the message goes out, both from the field first and foremost, but also from the headquarters side, to give the right resources to enable the operations to be able to deliver. So it takes two to tango, and this is what we're talking about. It's really this balancing in between the most important role that has to be played by the operation and the leaders and the team on the ground, with support from the headquarters from outside, but this support also has to be at the right way. So it doesn't overpower the ability or the space of the operation, yet it's helpful to help them to be able to move forward. Neil, over to you.
Thank you, Panos. Just to say that we had asked a number of you through the polling function to put in a bit of an evaluation of the webinar. So if you could do that either now or maybe in the few minutes after we wrap up. With that, there was one other question which I'll just touch on myself, which was the lessons learned you've discussed come primarily from large-scale L3 emergencies. How much of this learning is applicable to smaller non-L3 situations? You know, as I said at the beginning of the session, the OPRs are part of a much larger package of support and activities through the Transformative Agenda. And the OPRs try to feed into that through learning. And through that, we have tried to, we've made improvements to the humanitarian program cycle and all the guidance that's surrounding that. And we've tried to disseminate the lessons as broadly as possible, one of the methods being, of course, this STAIT. So the lessons are applicable to smaller non-L3 situations. It varies, of course, case by case, but issues of having good leadership, issues of coordination, issues of accountability apply in all situations, not simply in L3. The trick is to draw the lessons we have from this intense review in the OPR and apply it to make all humanitarian response more effective. So with that, I'll thank my colleagues Panos and Ingrid for presenting today, and all of you for joining in. I'd like to remind you again that the poll is open to give your evaluation. This is the first webinar we've done with a big open audience, and we need your feedback to make sure that this tool can be more useful for more people. With that, using the language we should use as humanitarians, I'll say over and out.